JR, what does your workplace do to promote mental health?
That's a really cool question. My workplace right now, they allow employees to work from home twice a week, specific days. So if you have anything to do, appointments, you can schedule. If you want to schedule something to be out of the office, you can do it on those 2 days. It's not specifically for mental health, but kind of falls in there.
I got that dish. Got that. I got that dish. 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 I got that dish. I got that dish. That dish.
Hey y'all, it's Onika.
And JR.
And you are dishing with Dainty Dish. How are you doing today, JR?
I am doing well, Onika. How are you?
I'm doing really, really well myself. This is going to be aired after Mental Illness Awareness Week. So we celebrated that last week and it was amazing. But we're going to be talking to Dr. Alex today about workplace mental health. I'm so excited to have you on the podcast, Alex. I'm like, I've been wanting to do this podcast for a really, really long time, but my workplace is one of those spaces where mental health is, complete focus, and I needed an expert. So we got the expert. So Alex, how you doing today?
Well, thank you so much for having me. I am super excited to be here. I am so happy we met. That was also
serendipitous.
Totally. So we met at the Mental Illness Awareness Week, the press conference where they released the theme, connectivity.
Connectivity.
Yeah, and we're filming this recording this during Mental Illness Awareness Week. It's perfect.
Yes.
I'm very excited to be here with both of you. Thank you for inviting me.
Thank you for coming. So tell the listening audience, just a little bit about yourself, who you are, what you do, a little bit about your background. Just give it to us.
For sure. So I recently finished my PhD in industrial organizational psychology at the University of Guelph. So industrial organizational psychology is the application of psychology to the workplace. I worked in the occupational health and positive psychology research lab. My supervisor was Dr. Gloria Gonzalez Morales. So all of our research focused on promoting well-being at work. So I just finished about 2 months ago at the beginning of August, and I am currently working for Rogers as their mental health program lead. So I am responsible for developing, in collaboration with my colleagues, developing the mental health strategy and implementing that strategy and promoting well-being at Rogers. And we have 26,000 employees there. Okay. So it's a very cool job. It's exactly what I wanted to be doing. There were a couple months where I was finishing up my PhD and working at the same time, and it was really interesting to see the overlap between my research and the actual work that I'm doing at Rogers.
Okay, well, tell us a little bit about your research.
So I looked at uncivil behavior in the workplace. Incivility is that low-intensity, ambiguous behavior that can often be interpreted as rude. So these are behaviors that many employees experience on a regular basis. So it might involve ignoring someone or not inviting a colleague to lunch, or if you're a leader or a colleague, not providing an employee with feedback. And there's different forms of uncivil behaviors. Often someone might engage in a behavior. They might not even recognize that they were uncivil or that they were rude, but their colleague or their direct report might still be offended by that behavior. So, for example, if your manager doesn't say good morning, or if your manager doesn't say goodbye at the end of the day, you might feel that your manager ignored you, and that can be stressful. It can be anxiety provoking. For many individuals, they'll spend time ruminating on those behaviors. And when that kind of thing builds up over time, it can have serious effects for well-being, specifically stress and anxiety. So that was what I looked at. I looked at the relationships between experiencing uncivil behavior and a host of well-being variables, including stress, burnout, anxiety, and depression, as well as some job attitudes like job satisfaction, turnover intentions. And I also looked at whether people who experience uncivil behavior are more likely to then enact uncivil behavior towards others. And we saw a very strong relationship. So if you're treated rudely, it's often going to lead you to treat other people rudely, and that can have a spiraling effect and can lead to a really negative climate at work.
You mentioned turnover. Let's talk about this revolving door that can happen when you are dealing with mental health issues and concerns, and your employer doesn't necessarily recognize that you're struggling. So you have to quit your job for whatever reason.
So absenteeism, so missing work, turning over, the research shows that uncivil behavior, negative workplace climates, that is very highly related to both absenteeism and turnover. In fact, according to the Mental Health Commission of Canada, 1 in 5 Canadians experience a mental health problem or illness each year, which we know that statistic. But that actually equates to 500,000 employees who are unable to work every week due to a mental health problem or illness. So employees are missing work, and they're also turning over. They're leaving the organization. And this isn't surprising. The millennials make up the majority of the workforce today.
They're not going to take it.
They prioritize mental health, and if the organization doesn't care for their well-being, they're leaving. They're going to hop to the next organization that is going to prioritize mental health.
So do you think that's usually what happens when the organization is in denial about people's mental health and their well-being?
100%. I mean, it's hard for me to even imagine an organization that's in denial of mental health. I think at the end of the day, it's those organizations that are going to suffer. It's going to hurt their bottom line. Again, employees aren't showing up to work. That has an impact on the organization's performance and productivity. Something else, so there's absenteeism, but there's also another phenomenon called presenteeism. So that occurs when employees come into work when they're sick. So we often use that word to describe or to refer to employees who are coming into work sick with a physical illness, like having the flu, for example. But when employees come into work when they're struggling with mental health issues, it's also affecting their ability to work effectively and to be productive. And at the end of the day, that is going to hurt an organization's bottom line.
How can workplace... Oh, sorry, did you have a question, Jared?
No, I was like, that was well put.
That was really well put. How
you.
can workplace design contribute to mental health?
Yeah, so workplace design. So I think exposure to physical conditions at work can certainly affect one's physical or mental health. So, for example, poor lighting can cause headaches, eye strain, and fatigue, and that can then contribute to stress, anxiety, and potentially depression. On the other hand, we know that sunlight exposure has a positive impact for mental health, and research also shows that it is related positively to job satisfaction and organizational commitment. So when organizations are revamping their workspace, they need to consider how the physical conditions are going to impact an employee's well-being. And it's important for organizations to have space for collaboration, but they should also have space for employees to spend time on their own, to recover, to meditate. Having a quiet space for employees is very important. At Rogers, actually, we work in what's called share space, and they implemented share space a few years ago. We can work anywhere. So we have a space, like each team has a space that they typically work in, but each and every day we come in, we get a new desk, we have a locker for our stuff, but they've designed the workplace in a way that whatever you need for you that day, it's accessible. So they have libraries with books if you want to work somewhere quiet and it really has that library feel. They have cafes with booths so that if you want to work in a cafe and you want to get that kind of feel, that kind of atmosphere, that's available for you. So I think that's it's really cool because they've really taken into account how they can design the physical structure in a way that promotes employee well-being.
So, with all these changes that people are expecting workplaces to implement, should they, in your opinion, should they be responsible for mental health in the workplace, like the employee assistance program? Should they be responsible for covering mental health concerns for their employees?
100%. I think employee assistance programs or employee and family assistance programs, I often refer to it as EFAP, it certainly needs to provide mental health services. From what I understand, when these EAP or EFAP programs were originally developed, I think they provided therapy for individuals who were addicted to drugs or alcohol. I think that's what I understand. So I think employee assistance programs, from what I understand, provide mental health services to employees. But what's interesting is that they also offer a host of other services. They offer financial counseling. They offer coaching for well-being. So these employee assistance programs are offering a host of services, and they're free to employees. They cost organizations money, but at the end of the day, they're saving organizations money because they're allowing employees to access a service in hopes that the employees will stay healthy at work. Unfortunately, a lot of people don't actually know about employee assistance programs, and we have access to free therapy, to free short-term therapy with the employee assistance program, and I'm trying to get the word out, not only at work but also my friends who are working for large companies. I've recently told them about their employee assistance programs. They can go for career counseling if they want, and they didn't know that these programs existed.
Mm-hmm. Isn't there like a fear that if you utilize your company's plans to receive mental health care, that somehow the word is going to get back to your employer and you're going to have to deal with the repercussions or the stigma of that information being made public?
I think there's definitely a fear. The same thing can be said about responding to surveys. Even when I was doing research and we had employees respond to surveys about their well-being, there's always that fear that it's going to get back to the employer. But it is completely confidential. It will not get back to the manager. These services are completely and totally confidential, as is any medical service. They treat users of the program just as a family doctor would treat a patient.
I think I sent you this link to this article. It said that 60% of Canadians with mental health concerns are not using workplace support tools. Do you think this is an accurate number? Like, do you think, is it high? Is it low? Too low? Like, what, in your opinion, what?
No, that sounds accurate, that 60% of people are not using it. I guess I'd be curious to know what the percentage of people, this would be hard, it would be hard to find the statistic, but how many people who might want to use it are not using it? I mean, I think there's so many incredible services that why wouldn't anyone want access to these free services? But I think that's accurate. I don't think employees are using it enough.
Do you think it's a certain level? We talked about fear earlier, fear driving people's actions sometimes. Do you think it's fear that's causing employees to not necessarily approach management about like mental health concerns? I know in my past that's been the case. I came up with like a hullabaloo of a lie for my last employer about my mental health because I was so terrified that they would find out that I was bipolar and it would affect, and it's from past experiences, right? Where I haven't shared that my mental health, and then I did disclose my mental health, and things kind of just like the tides change and the tides turn. So is there that level of fear sometimes with people when it comes to their mental health, sharing that with management?
For sure. I think even if you have a supportive manager, you don't necessarily want to share, and that goes back to the idea of stigma. No matter how supportive your manager is, you still fear that you're going to be labeled, that you're going to be looked at differently. And just to provide a couple statistics, a 2017 report by Deloitte found that 95% of employees who took time off for stress recovery cited something else as the reason. And another study that was conducted by the Globe and Mail and Morneau Chappelle, they had 1,500 voluntary participants, and 55% of those respondents did not tell their workplace about their mental health issue. So for sure, employees are afraid to disclose, and a big part of that is because of stigma.
What about language? Also language used in the workplace. I mean, if I'm sitting in a cubicle, which I wouldn't be because I don't have a cubicle life anymore, but let's say I was sitting in a cubicle and the person beside me was just like, oh my gosh, I'm feeling so depressed today, or like, oh, I have this like high anxiety about this like presentation, or I'm feeling really schizophrenic. Like you got, the buzz terms that people tend to use, or just saying in general, you're crazy or you're insane, or just that language floating around the workplace.
Yeah.
How does that affect mental health?
So I think a lot of us often use mental health disorders as adjectives, like I'm so OCD or I'm so schizophrenic, right? But when we use that kind of language, we're diminishing the seriousness of mental illness, and we're also feeding misunderstanding of mental health, which then perpetuates stigma. Or other phrases like just snap out of it. Again, we're delegitimizing someone's mental illness. It puts the blame on the person experiencing it by making it seem like it's a choice. So we need to be conscious of our language, because OCD, schizophrenia, these are mental health disorders. We should all, we need one way to at least try to fight stigmas, to educate ourselves, to understand what is mental illness, what is OCD, what is schizophrenia, what is depression, what does that look like? And if I have a colleague or if I'm experiencing it, how do we cope? How do we help somebody else cope?
Seeing as people spend most of their time, it feels like, at work, shouldn't workplaces take responsibility? And this is going to be an interesting conversation, I think, but take responsibility for people's mental health and well-being. Like, shouldn't it be a top priority for them that their employees are mentally well?
I mean, I think so. This is what I'm doing at Rogers, right?
I like the way you guys are putting me on the spot. I mean, as an employee, your job is to do the job that you were hired for. I mean, as an employer, it's not necessarily your concern about the employee's personal life. Your concern is, can they do the job they were hired for, and can they do it in the time and with the efficiency that you require them to do it in.
Do you think employees are going... Now I'm throwing the question back at you.
Yeah.
Do you think employees are going to perform as well if it's just about coming into work and doing the work without focusing on who you are as a person?
See, I can understand both sides of it. Because I'll give an example of a job that I had earlier in my life in the restaurant industry. In the kitchen, nobody cares. I don't care about your mental health. I don't care about your sister, your grandma, your mom. I don't care. And the customer is sitting at the table, doesn't care. They want their meal. They want it at the same time as the person sitting with them, and they want it to taste good, and they want to enjoy their time, and that's all they care about. And your role in that organization is to fulfill that request with no excuses. However, there are other jobs where I am today where, to some degree, I guess it is a concern, and they want employees to work at peak performance at all times. So they're willing to give people the ability to take time off. And for what I'm recognizing now is that my colleagues, some of them put in extra time. They go above and beyond because they have the flexibility to take care of themselves, their mental health, and the mental health of the people around them and their families. So I can see both sides. I'm not going to go on a wing and just be totally one-sided.
When you're in a good mood, are you more productive?
Yes.
Yeah. Like when I'm in a good mood, I just do everything better. Whether it's at the gym, I'm going to work out harder. If I'm in a bad mood, no, I'm not going to work out as hard. So I think this is what I'm very passionate about, is about how do we train leaders to care about their employees' well-being. So I learned this. I was working as a teaching assistant in the MBA program at the University of Guelph. And the professor would not allow any of the students to use the word manager, because you don't manage people. You manage tasks. You lead people. If you want to be a good leader, you need to find a way to connect with your people, to show them that you care about their well-being. I don't care how stressed you are. When you are facilitating a meeting with your team, you take the time. I don't care if it's 2 minutes. I don't care if it's 10 minutes. But take the time to show your employees and your people that you care about them. Get to know them. If you dive right into the work and you don't take the time to demonstrate care, it's going to affect their performance.
I disagree. Sometimes you just want to dive into the work, and sometimes you don't want to deal with all that emotional stuff. Like I know there's sometimes in my work where we go into a meeting and sometimes some managers will take the time to like do that catch up how are the kids? Oh, how was Jimmy's recital? All that good stuff. Like, or oh yeah, is everything good? You were sick last week.
Okay, so my question is, what about in a high stress time where you're just talking about work and you're not following up with employees and asking them, how are you doing during this stressful time? That's when I think it's really important to take a little bit of time, 1 minute, if that's all you need to take. Just take a little bit of time to show your people that you care. And that's what makes a good leader. And that's what differentiates good leaders from bad leaders.
Most definitely.
So I'm very passionate about leadership training. Training leaders to not just dive into the business, but to focus on employee well-being. And speaking of leadership, I think organizations have a responsibility to provide mental health training to leaders, to train leaders, to provide them with education around mental illness, different types of mental illness, how to recognize signs that one of your people might be experiencing a mental illness or a mental health challenge, providing them with strategies to help support employees, and also ensuring that your leaders know about the resources and support that your company offers so you can direct your employees to those resources. Leaders need to be the champions for mental health. It starts at the top.
I'm going to come out of left field here.
Go for it.
So if it's a leader's responsibility to learn about mental health, would you say it's a leader's responsibility to learn about cardiac health? Because I mean, your employees could have bad eating habits that force them to have a heart attack, and they lose work time at work.
No.
How do we determine which?
No, because mental health issues are highly prevalent in the workplace. I think cardiac issues are probably more specific to certain age groups. I'm not an expert on that. But I'm not saying that leaders need to be an expert on every type of mental illness. They should have an understanding of anxiety and depression because those are the most common mental health challenges that people experience. So understand what anxiety and depression is and know how to support your employees and to direct them to the resources that their people could benefit from. So understanding, about cardiac.
Well, I'm just thinking because obesity is there's obesity we've said like out there is there's a crisis of obesity. So well, bad health is killing people as well as mental health issues. So I'm just saying, how do we determine where do we draw the line of the responsibility of the organization and the responsibility of the individual? That's all I'm trying. I
think that's a great question. At Rogers, we focus on whole person well-being. So we're looking at physical health, we're looking at financial health, and we're offering our employees resources and supports so that they can learn more about physical health. But in terms of a leader's role, is it a leader's role to step in and to say to someone, you're not eating well?
Yeah.
No, I don't think so. I also don't think a leader would necessarily step in and say, what you're doing, that's going to, contribute to anxiety. So it's not about telling employees. It's about being able to recognize if an employee is struggling. So if an employee is very overweight and they've expressed that they're struggling with it, a leader should know how to best respond to that and where to direct them.
Okay. So being able to guide your direct reports to the necessary resources that can help them.
So what kind of strategies can workplaces implement for mental health and wellness?
Okay, so I like to think of strategies from various perspectives. So from an organizational level perspective, a leader perspective, and a group level perspective. So I've spoken a little bit about suggestions in relation to leadership. I think we need leaders as champions for mental health. So organizations should certainly foster mental health awareness and encourage conversation around mental health. When leaders do that, when leaders talk about their personal experiences, they are helping to break the stigma because they're opening the floor to conversation. They're promoting conversation. They're saying that this is okay and that this is normal. So that's one way to help foster awareness, is to get leaders to share. And there's different mediums, that leaders can share their message. I know at Rogers, we have Rogers Zone, which is it's our portal for all employees to access. We also have a Facebook. It's not Facebook, but it's basically Facebook for Rogers, where we can share messages. So it's making use of those communication mediums to share stories. So leaders should share stories. Employees might also share stories. Offering educational campaigns. So taking advantage of Mental Illness Awareness Week, which I know is just in Canada. If we have any listeners outside of Canada, it is a week devoted to ensuring that society. You can speak better about Mental Illness Awareness Week. Actually,
it's a week in Canada where we promote awareness for mental illness.
Yes,
where we stop the stigma, and again, we're just raising awareness, and it happens all across Canada. For our American listeners, your mental illness or mental health awareness month is in May, and World Mental Health Day is October 10th,
which is coming up
on Thursday.
Yeah, and we also have Mental Health Week, which is in May. So organizations should really take advantage of those weeks and develop some sort of educational campaign. So encouraging conversations about mental health. I've spoken a little bit about that. And then using those communication outlets to talk about mental health, sharing articles about mental health and strategies for coping and for building resilience. So that's what the organization can do at a high level. And I think organizations also have a responsibility to understand the major stressors that specific business units and teams are experiencing and providing customized supports to those business units. That's exactly what I'm doing at Rogers right now. I'm providing customized support to various business units to promote their mental health. But I do think that this isn't a role that exists in all organizations. I think in time, organizations will begin to hire people to focus specifically on the mental health of their people.
I forgot to mention it. Commissive and omissive.
Oh.
Can you please define that for me?
Yes. So, omissive behavior. So this referred... Onika and I were having a conversation about my research. That was when we started talking about commissive and omissive behaviors. So omission. That means we're not engaging in a behavior. So I'm not inviting you to lunch, or I'm not saying hello to you in the morning. I'm leaving you out. I've failed to engage in a behavior. commissive behaviors refer to actions that we are engaging in. So making a snarky comment, for example, rolling your eyes. These are commissive behaviors. And researchers have actually theorized that omissive behaviors are more harmful. When we engage in a commissive behavior, we're actually acknowledging that this person exists. It's rude, but we're saying, you're worth my time. I'm actually going to roll my eyes at you. I'm listening to what you're saying and I'm rolling my eyes at you. An omissive behavior, like not inviting someone to lunch, leaving someone out, that is getting at our core. We have a human need to belong. And when we don't feel that we belong, when we're being left out, when we're not being invited to lunch, it's those behaviors that actually have the greatest harm for our well-being.
And we talked a little bit about cold culture when we were having our production meeting just a minute ago. Can you talk to me, when I say cold culture, I mean like an unemotional, let's say your management doesn't listen to you or they don't take into consideration your mental health. They're just like the old boys club type of management style. How does that affect people's mental health?
I think it's hard. And as I said earlier, I think at the end of the day, these companies are going to be the ones that suffer as millennials and Gen Z continue to enter the workplace. They're not going to put up with that, and they're going to jump ship. I can think of friends who, our generation, they're turning over when they're not getting what they want, and we prioritize our well-being. So I know that in certain industries, certain companies, there is not a focus on well-being, especially in industries where you're required to work a certain number of hours per week, when you have to meet a certain number of billable hours. That's very stressful, high pressure, and yes, a lot of people do it for many, many years, but are they happy? And how does that affect them?
What's the one thing about workplace mental health that people don't know that you think they should?
I think it goes back to those employee assistance programs. I get very upset when I hear that employees don't know about the employee assistance program. It's a free resource to us. We get free therapy. We can go for career counseling. So Morna Chappelle is Canada's largest provider for employee assistance programs. And I know that they provide managers. So managers who have people that report to them, you can call 24 hours a day if you need support on an issue related to your people. If you need support, if you're not sure how to go about dealing with a specific situation, you can call Morna Chappelle. And people aren't using this service. That's what I want to get out. I want people to know that if you're working for a large corporation, you definitely have an employee assistance program at your fingertips. I know not every company will have an employee assistance program, especially smaller companies, but look into it if you don't know about it.
Any advice on dealing with, I guess, aggressive or passive-aggressive coworkers? I know we talked about it briefly before.
So passive aggression. So I think passive aggression, when people are passive aggressive, they know that they're being passive aggressive, right? So how do you cope with these people? I mean, at the end of the day, if they're being passive aggressive, I want to say like try to recognize and reframe your thoughts. If it's really having a negative impact on you, reframe your thoughts and recognize that there's a problem, there's something going on with this person if they're continuously being passive aggressive. And if it is happening over and over again, see if you can confront the person in a respectful way, in a mature way, and if necessary, speak to a manager to help to help find a solution if it is happening on a regular basis. If it happens once, I wouldn't necessarily say go and approach the person. Try to reframe your thoughts, and that's based on cognitive behavioral therapy. This isn't in reference to passive aggression, but when ambiguous events happen, human beings tend to look at them negatively. We were born, humans evolved to look at the world negatively because that was our mechanism for survival. We had to focus on the negative because if there was a bear, we had to notice that bear and we had to either fight or flight, right? Fight or flight response. So our brains have evolved to focus on the negative. And that's why it's important to practice reframing our thoughts and engaging in other positive practices, whether that's meditation or practicing gratitude. I'm a huge believer in gratitude because it's just so simple. Yeah. Mm-hmm. You literally just, write down 3 things you're grateful for every day. It boosts positive emotions. And it enables us to recognize the things in our life that we often take for granted. When we're sick, when you're sick with a fever or a cold or you have the flu, what do you want? Like, you just want to be able to get out of bed and go for a walk and eat the things you normally eat. And on an everyday basis, we take those things for granted. But when we practice gratitude, the research shows that when you practice gratitude for 21 days, it already starts to restructure your brain to focus and to see the positive. Sorry, I just went on a rant, but
that is okay. We love rants on this show.
That comes from my passion for positive psychology.
Yes.
So, I guess thank you for being here.
Thank you for inviting me. I'm
Alex,
just glad that I have a new friend now. New friends. And this is my first podcast, which was super cool for me.
That's good. I'm glad you enjoyed yourself, and thank you so much for being here. If you guys have any questions on, because it's the tip of the iceberg, we might have you on the show again if you're willing to come.
I would love to.
Let's talk about workplace mental health.
I would love to.
So if you guys have any questions for Alex, if you're going through a tough time at work and you're having mental health struggles and you don't necessarily know what to do about it because you're working in a toxic work environment, and you need a hand, Alex would definitely be able to answer some of those questions. I can get them to her. JR, please, and if you want to say hi to me, of course, JR, please tell them how they can reach us.
Yeah, definitely. You can reach Onika at Dysh, DYSH, at daintydysh.com. That's DAINTYDYSH.com. Thank you so much for listening. If you're listening to us on Apple Podcasts,
give us 5, deserve 5.
We truly appreciate you. Thank you so much. Thank you for subscribing. If you're listening to us on any other platform, please subscribe. We truly appreciate the feedback. Thank you so much. To all the listeners, thank you. And we will be around next week.
Thank you, JR. Thank you again, Alex. Alex, is there anyone you want to give a shout out to before we sign off?
Oh, lots of people. My family. My family will definitely be listening to this podcast. They have supported me throughout school, throughout my master's, throughout my PhD. My friends and my colleagues too. I am just super grateful to be working with such supportive, bright individuals who also care about my personal and professional growth. I couldn't be happier to be working in such an amazing workplace with amazing people. Yeah.
Perfect. Well, that has been the dish of the day, and I hope you guys have yourselves a very, very, very happy